first I will go over things with you,
Okay.
which we already know, and then I will review the scan with you, and
Sorry, you didn't
oh,
get here.
is that, oh,
No, I just wanted to make sure you came.
You know,
okay.
your toilet paper in here is almost like newspaper, so.
And then we will go over the scans, and then we'll discuss what options do we have, and then I will, and at the same time, you tell me what you think,
Okay.
and then we'll go from there.
Okay. Sounds good.
So, to use some shortcut, let me open Alex note. So, it looks like in November you had a CT scan. And why did you got the scans?
I thought it was a kidney stone.
Okay.
This was in Rock Springs, right? You're
Yeah.
talking? Yeah. I thought it was another kidney stone because I had one back in 2014. And the same abdominal pain as when I had a kidney stone, so it felt like it went through pain like for 3 days. One day I took some painkillers and that knocked me out for the next day, and I woke up and I was still in pain, so that's why I told my wife, we got to go to the hospital.
Okay. And so you got the scan, and then it looked like then you were recommended to get an ultrasound.
Yeah.
Oh no,
And-
no,
or
ultrasound.
They did the ultrasound over at the other place just to see what was in my bladder, but
Okay, it was for the bladder. Okay.
yeah, that was Dr. Peterson, I do believe.
Yeah.
Okay. So when you got the CT scan, did anyone tell you about the kidney thing?
This last time they did. In 2014 they didn't.
2014, nothing. Okay.
Yeah.
So then things went fine. You didn't have more kidney stones from 2014 to 20th.
Yeah, there was still some kidney stones I had from 2014, but I passed them, within the course of a couple weeks.
Okay.
So.
And you didn't have more CT scans, I believe.
No.
Okay. And in 2020, you had a CT scan. And what prompted the CT scan?
That's when I thought I had another kidney stone.
stone, okay.
Yeah, because with 3 days of pain and
Okay.
yeah.
Okay, got it. This is the thing. So you had the CT scans, and then you had another CT scan to have a better look at it.
Yeah, with the contrast.
With
Then
the
they
contrast.
scheduled me with another CT with contrast to go in.
And then you came and you met my colleague Alex, and you recently underwent a biopsy.
Yes, just did the biopsy within I guess that was a live CT scan there
Yes.
for the biopsy. Yeah. And that thing produced pain yesterday, had some good pain yesterday.
And
Yeah.
what we are taking for pain?
That was a ibuprofen I took yesterday. I have a high pain tolerance. It takes a lot for me I don't like painkillers because they make me nauseous, and so for me to take a painkiller, I'm bad. Usually I don't even take the ibuprofen because I could rather deal with that pain than, yeah.
You had something to add?
Oh no,
No. Okay.
all right.
So, what other medical problems do you have? I see just high blood pressure.
I don't even know if my blood pressure is high. It was that day I went in, I must have been nervous because it was
Okay.
high, but
He never has
every
anything
house
else.
we've been going, and maybe even with the biopsy and all that, they said my blood pressure looks great.
Okay. So no one, like your primary care, never told you are. having
Yeah,
high blood-
he did, but that was when I seen him. That was the only time I seen him. So I
Okay.
don't think he had enough
Okay, readings.
medical on me, to
Yeah.
be telling me that in the first place. I mean, he prescribed me some high blood pressure medicine, and I took it the next morning. I took one, and then that was it.
Mhm.
I haven't taken it since.
Yeah. So, still today your blood pressure.
It was high today,
Yeah.
but I just got my needles.
It might be pain. It might be the
and
needles,
I fear needles.
and you
I
need
don't
to
know
be
why, but
comfortable till you see me. The best thing is to have blood pressure in a week at home.
yeah. Let me meditate a few minutes and then
Yes.
come in and take my blood pressure, and it'll be a lot better.
Then I see you had some back surgery, a carpal tunnel surgery, and a neck surgery.
Yes.
why you underwent all this? Were you a soccer player, like
No.
boxer, or
Back surgery just was a work incident. That was when I was younger, probably what, 21, 22, somewhere around in there, I think,
Mhm.
years of age. My neck, I woke up one morning and I couldn't even use, what was this hand? See, yeah. I couldn't even use it. It was nothing. I could not, that was it. If I let it this way, I could move it a little bit, but this way there was nothing. And I almost thought, I was hoping I didn't have a stroke or something like that. So, which I know now that they got medication to reverse that, so if that ever happens again, I'm going right to the emergency room to, have that done. But, and
so these all were work related? The neck one?
right in through here. I guess it went in right in here in the front. And then corporal tunnel was just,
Anyone in your family has history of cancer?
Yeah, my mom's side. My dad died of cancer. My mom's side, it's more.
And what did your dad have?
I don't know exactly what
But
cancer
it was
he
cancer?
did. Yeah,
Yes.
yeah.
Okay.
I think it was lung.
Lung cancer.
Yeah. Anyone else?
My opa, he died of colon cancer.
Yeah.
And my aunt Mariana and my uncle Allo, they both had
Colon cancer.
colon cancer. But my mom hasn't. So I was wondering if that was maybe just related to that part of Germany. I don't know. Because that's what she's, from the hometown she's in. So hard to say. Maybe she's lucky and just didn't get it.
And so you are 51 now. Did you have your colonoscopy?
Yeah, I had colonoscopy. I think when I was 45. That's about the time that my first kidney stone. Because I was getting them. I've had these. I don't know. It's maybe a few years before then. These abdominal pains I really get that hurt, and I don't know what that's. And they still don't know what that's really created from. Maybe it's from what I have now. I don't know.
And the colonoscopy was good?
Good.
Yeah.
Good.
Okay.
So
And
everything looked great. Yeah.
and when did they want you to come back?
They never did say.
Okay, it should be on.
It probably said, we just never,
Yeah, because
there were like 5
so
years.
yeah, usually they say either 3 years, 5 years, 10 years. Looking at your family history, I guess they would have said 5 years. So if we can check on that, I mean, I know right now these things take precedence.
Yeah.
But once we get settled with this thing, we need to focus on our routine surveillance
Okay.
things. Okay. Now, do you smoke?
I did.
Okay. And you quit
Yeah.
on January 30th. You smoked for around 40 years, a pack a day?
Probably. Yeah. I wouldn't say a pack a day, but I mean, lately I was only maybe a pack a week.
Okay. Okay.
Yeah. I mean, I had
Kind of
maybe.
fluctuated,
There was
probably.
a time, probably in my 30s, I'd smoke a pack a day.
Everyone used to smoke.
You know, and it, yeah, I started like when I was 12. It was.
Got
Yeah, hard to believe.
Yeah.
Little
And-
kid smoking.
Now kids vape. You don't vape, right?
No.
Okay, good. Don't vape. They are making fool everywhere.
Yeah.
Bad.
It's even worse than smoking. So
Okay.
Oh well.
It's good to hear.
Yeah, it's good to know.
I'll tell my friends that then. Hey, a doctor told me.
yeah, so they put unknown things to give flavor, and
Yeah.
lungs react very badly.
Yeah, it's propylene glycol and
Yeah.
vegetable glycerin.
Yes, I don't know what.
That's the two main ingredients.
Yeah. So it's
And then
really
flavoring
bad.
on top of that.
Yeah, you smoke, you get side effects after many years. With vaping, you can get anytime.
Wow.
You just need to get that batch and
Bad batch and
Oy.
what sort of work do you do? Or you are retired now? Or?
I was sort of like retired. I had my own business for many years, and then started doing some maintenance work for a company, LDE.
Mhm.
And we were putting a plant together, and then they liked my work, and they wanted to keep me around, so I've been sticking with them still. So just do whatever needs done, change valves.
So, let's go from head to toe and then we'll look at the images. Okay?
Okay.
So, do you have any headaches?
I did get one about right in here the other day. Sort of felt like, I guess it would be a migraine or something, and sort of felt like I was going to get one today, but
And
not.
so, it's not every.
Not every, no.
Do you have any blurriness of vision?
Oh yeah. always. I mean,
It's a chronic
should-
thing, or
I should wear glasses, but I don't like glasses. They just you can never find a pair that fits good. They always falling off your face, and you know.
Jesus.
I
Don't
don't
be
know.
blind.
I'm serious.
they don't fall.
Mine do. Mine get stretched out for some. Probably because I put them in my back pocket and things.
Have you watched Matrix?
Watch what? Yeah.
There's
Matrix.
Matrix.
So in that Lawrence Fishburne, he wears a
Oh, yeah.
glass, and there is no support on anything.
Really? That's what I
You need
something,
those.
And he fights also. They jumps. So
Zaps.
they don't fall. Okay. Any balance problems?
No.
Any nausea or vomiting?
No.
Any chest pain or shortness of breath?
No. Well, I have noticed that I get sort of, I don't know, winded earlier, it seems like, but it's actually to be my old age. You know, it's,
Any belly pain?
yeah.
And can
I
you
get
point
that.
out where?
I get right about right in here to right to here. About the pubic line up on the,
Got it.
like right now, I just, you know, from the biopsy, I can, you know, feel, it feels like they went all the way through me though. I can feel it right back here all the way across, and then, yeah. And then I've been getting pain right here underneath this rib. Well, underneath the ribs right here.
On the,
Almost like a running pain or
so
something.
both on the left side and right side.
Right, left and right. When I stretch, it feels like, I don't know if I can feel that thing grabbing a hold or something, but it's like when I twist a little bit, I can feel like something pulling, I don't know, just my, in between my back there.
Right now, any tingling, numbness of hands and feet?
No, when I drive, yeah, but it's, but
If I ask you to walk, how far can you walk?
15, 20 miles, I don't know, I can walk. I have no
15,
problem.
20 miles.
Yeah, I can.
Might be a little winded. My knees might hurt, but
Any constipation, diarrhea?
No.
Okay. Any blood in your urine, stools?
Just from after the,
Procedure.
yeah.
But not before that.
No.
Okay. Has anyone ever told you you have an autoimmune disease, meaning psoriasis, rheumatoid arthritis?
I think I have psoriasis. No one's ever told me, but like I got this one patch of right there.
Okay.
on your knees too.
Never gone.
Oh.
On my knees. Had it on my knee.
And has anyone like biopsied
No.
or nothing?
I'm guessing that's what it is, but
And you have it on knees also?
no, it went away on my knees. I had a guy in Alaska, a friend up there. He has it, and I had stopped him. We were BSing out the window, and he saw that and goes, "Hey, you got psoriasis." I didn't even know what it was, and so I go, "Yeah, I guess it is."
Have you ever been on high dose steroids or methotrexate or something like that?
No.
No ulcerative colitis, Crohn's disease, nothing like that. Someone told you. Okay.
I don't think so.
No immunosuppression. So
No steroids.
now let's look at the scans then. Okay.
Okay.
Have you ever already looked with Alex or?
Myself, you know.
Yeah, no, we looked.
No one.
Yeah, we looked with him.
With who?
With Dr. Sanchez.
Did we?
Yeah. Oh yeah.
Okay, I got memory problems.
Yeah, we went through all of the scans because he showed us how big it was and it was attached and it should be
Oh
blank,
yeah,
open black
yeah.
space.
Yes, we went.
I just had.
So this is the chest CT. We will go from neck down. This is the windpipe we call as trachea.
Okay.
This is your right shoulder. This is your left shoulder, and then we'll go down. Okay.
Okay.
So this
That's
is
about the lungs.
yeah. This is the right lung. This is the left lung.
Does that look good or no?
Yeah. And so what I am looking here is kind of an abnormal spot, like a round circle. To
Like
see.
that?
No. So these are.
What about like that round circle?
So they're like these, but they should not be connected to a blood vessel. So if they are connected, it means it's just a conjecture of
Okay.
a blood vessel. So we go down, 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 and we do not see abnormal spots.
That dark circle was nothing? No?
No.
I mean like this?
So no, so these things are just blood vessels.
Okay.
And what we are seeing is this blood flow. This central part is the heart.
Okay.
So these things, if they are traveling, they are normal. If they are stationary, we call it.
Is that diaphragm coming up there?
Yeah, and so the diaphragm, and then this is the liver, the spleen, but
Okay.
we will look them into a different view for
Okay.
a better vision. Again, this is the lower part of the heart, lungs, and we are looking into it. So this is the liver.
Okay.
I do not see any abnormal spot. This is the stomach. It was kind of full. The spleen.
It was kind of full. It should have been empty though, right?
I don't know. You thought that it will be empty, so you made it sure. You overloaded it. So now the problem is, this is how the kidney should look like.
Okay.
And you see here, this all haziness, it's the tumor which is growing, and then if you look here, it looks like it is in the lymph nodes too.
Okay.
So that's the bad part. The good part is we
What
do not
was-
see the disease elsewhere.
Can you go back a little bit? What's this shiny bright light that was just? Now go back the other way, I guess. It'll pop up right here.
Which
No, no. Okay,
Let-
maybe go back the other way.
okay, let's go ahead.
And,
I will go slow.
it'll come up. I know. Right? No. Yeah, right there. That one.
This is calcium deposition in the blood vessel.
Okay.
So this is the main aorta.
Okay.
So here, if the calcium is deposited, it looks as white.
Okay. Calcium deposits. Okay.
Yeah. So
All right.
it's a normal process of aging.
So what are you looking for as far as
So-
everything's looking pretty much the same, like from different, what are you telling if what's bad and what's not, or
So the thing is, so first of all, I want to know from you, what have you discussed with Alex? Now we can have a seat,
oh, okay.
and you tell me, what have you discussed? Can I have it? And, and what do you plan to do next? And then I will tell you my thoughts
Okay.
and my rationale, and then we'll leave it to you. for the
Okay.
decision.
What I want to try is, even before I knew I had this tumor and all that, I probably had the tumor going on me. Maybe that's why my brain decided to start studying it. But I started looking into cancer, just reading about it, finding out where it likes to live and what makes it thrive, what makes it and things of that nature, and looking at other doctor studies and findings, and then I came across this guy, Dr. Simon Sinney, and what he was talking about correlated everything he was saying, blended with already what I've been looking into, that the cancer actually is a fungus, he says. The Candida fungus he's saying that is the cancer, and the treatment he's been doing, which makes total sense, is with sodium bicarbonate, to give it more alkalinity, to take away the acidics and stuff like that. And I guess the fungus really can't adapt to a sodium bicarbonate as fast as it can, to other alkalinities, salts and stuff like that in the body. So my plan is to go over to Italy and to go through his procedure, or his treatment. It's like a 30-day treatment, and to see what that does. And then if that doesn't work, then come back here to the States and go through the other treatments here.
Okay. Can you tell me the name of this? Can I just
Yes,
look?
Tullio Simoncini. Now, everything I've read bad about him on the internet was by other doctors or somebody trying to smear his name, really.
Okay.
Okay? But-
Can you spell the name?
Yeah, it's Simon, SIMONCINI.
They are one word?
Well, yeah, one word, Simon Sini. Yeah.
And Tully.
Or
Is
Doc-
it Tulio?
Yeah,
Simon
yeah.
Sin? Okay.
Tulio. Yeah, that's him.
Is this one the Wikipedia page?
You can't believe Wikipedia. Wikipedia is whoever wants to write their own stuff in there. I mean, yeah, they say he's like they said he's in prison for manslaughter, and I've been emailing him. I just spoke with him yesterday. I emailed and asked, told me all this. I heard news that you were been sentenced for manslaughter, and he goes, no, that was that's all just I can't remember how he put it, but basically this smear campaign on his name. Now, since he's been doing this, I've been finding other doctors now that are using this procedure and have been using this in the treatments also and been very successful with it. So there's a hospital in Arizona that's been doing it, but they're doing it along with other treatments. And so I wanted to try this first just to see if it actually does, and I think it would, if it does work, then I think that I would love to tell you about it, so maybe you could look into it also, to find another avenue or some of treatment. But the thing with chemo and immunocells or T cells is that when it's being put back in the body, it doesn't know whether what cells are good cells, and then you can attack other organs and I think that's where a lot of people die from cancers is due to the treatments, and I know it was more the chemo that that's what had done it to people, but and we're probably looking at more of immunotherapy, I'm thinking, but I just want to try something that's not going to kill my other organs first.
So you asked very pertinent questions, and we of course see these questions in our clinical practice. Sodium bicarbonate we use in our patients, especially if someone is getting high dose methotrexate. It's a chemotherapy, and when we give sodium bicarbonate, we actually give very high doses, so high doses which cannot be taken orally, and we pump it with IV stuff because it helps faster excretion of methotrexate. So methotrexate is a chemotherapy which we give for many different cancers, but especially for lymphoma we give very high doses, and there we want it to come out from the body very quickly, so we give this. The problem is with sodium bicarbonate and these things is that no matter how much we give, as long as we are breathing and as long as our kidneys are functioning, our pH will not change. So our body will quickly excrete it, because if our pH goes beyond 7.35 to 7.45, which is a very minute range, if you see, 7.35 to 7.45. Sodium bicarbonate, they are alkaline, even in 10 pH might be there or something, it's like very, but if the pH goes beyond that range, people might die. So as long as you are breathing and as long as your kidneys are functioning, no matter how much sodium bicarbonate you take, your normal body physiology will not let you go beyond this. I know there are many people who claim to cure cancer with these things, but what they actually do, and unfortunately I have very harsh opinions, is that they are playing with vulnerable people who see that, of course, cancer treatments are not easy, they have their own side effects, and no one wants to go through those things, and even if it's possible with us, we will never give those things. And here they play with those fear and try to take advantage of that. There are many clinics in Mexico, there are many in US, there are many elsewhere where they do the same things. They give all these cocktails of therapies and tell you not to do scans or things like that. And it's very easy for them to show that their things work. They have to take 50 people who get standard of care in this case surgery, or 50 people, they do give their treatment and publish the results. They will never do it. When you will ask, they will make all sorts of excuses that we cured, we did this, but who is stopping them from publishing their results?
Yeah.
And I come from India. We have the same things like Ayurveda and all those. Most things they don't work. I would have been okay with you trying all these things. The problem here is that we have a unique opportunity that probably everything can be taken out. But if we get a spot in the lungs, bones, somewhere else, it goes to the brain, then it becomes stage 4. Then probably as per our current knowledge, cutting it out will not benefit you. If we lose that opportunity, that limited period before which the cancer travels elsewhere, then it will, from a curable disease, potentially curable, I will not say that anything is 100% guaranteed. Our life is not guaranteed. I can't guarantee that I will
Wake up tomorrow kind of thing. Yeah,
that
exactly.
I will go from the clinic and I will reach back to Huntsman. So, but from a potentially curable situation, if the cancer progresses and goes elsewhere, it will become incurable.
Okay. Now, I heard it was on the top of my diaphragm too. I don't know if you had.
Right now, we discussed, and looking at the scans and everything, it can be resected completely.
Wow. Okay.
So,
Really? I see. Yeah.
But to be frank, you have a lot of disease in there with the lymph nodes and all those. Surgery will be big, and I can 100% guarantee sodium bicarbonate will not do any benefit.
Yeah, that's what he was saying with the lymph nodes. There's something else would need to be done there.
But
he said the tumor he could treat with the sodium bicarb, but he said the lymph nodes.
He is just making a fool. He cannot cure it because no matter we give tons of sodium bicarbonate in people with lymphoma, sodium bicarbonate doesn't do anything.
You putting the sodium bicarbonate right on it, or injecting it into it?
Into IV, because lymphoma is a systemic disease. So it's
Okay.
all over the body. Lymphoma is something, the cancer of a certain type of blood cells. So we have to give systemic chemotherapy, sodium bicarbonate. It's to maintain the urinary pH, doesn't.
Okay.
So that's what the thing is. I mean, sorry for the harsh words, but
No. It's
it's my duty to tell you, if you lose that opportunity, I will have still treatment options, but then it will not be curative. So what then I can do is probably will prolong your life, but in cancer, always we say surgery is the definitive curative option as per our knowledge. Even though with immunotherapies and chemo we can save some people, but if something can be cut out at the right time, that's the best treatment.
Okay, when you say extend my life, I mean,
if it goes elsewhere. As per our current understanding, if there is a stage 4 disease, theoretically we cannot cure it. We have new treatments which are immunotherapies which are there. We are seeing very good response. People are living, just last month we have 4 years data, and around 40% of the people, they were still in remission with the immunotherapy. But when to call it that the cancer has been cured, we do not know. Like, okay, if the cancer doesn't come back for 5 years, we say it's cured, or the cancer doesn't come back for 10 years, we say it's cured. We still do not know. We are having some exciting times with the treatments, but still, theoretically, we have not said that we can cure this.
okay.
Now, that was the treatment part. I will recommend surgery. The other option is to add something on top of surgery, which is an option if you would like to hear. Probably Alex would have discussed with you in brief. There is a medication called nivolumab. So what happens? Cancer cells, everyone felt that immune system can kill cancer cells, and we had some interferons, interleukins. These were old generation immunotherapies. They were very toxic, but surprisingly, even in stage 4 disease, it worked in around 10% of the people. And when they received it, not everyone was able to tolerate, but those few people, they continued to live for a long time, and then even after 10 years, the cancer did not come. But it was very toxic, and around 90% were not benefiting. So it was always a struggle that what is in the immune system which is which is not able to get rid of the cancer. And then we got to know around 2011 that cancer cells develop a receptor called PDL1. It's called programmed death ligand 1. And what it does on the immune cells, they have a complementary receptor called PD1. It's called programmed cell death 1. So when these receptors interact, it just shuts down the immune system. It tells the immune system, you don't need to come and kill me. Then we developed antibodies to block this receptor. They sit on the receptor, so the signal doesn't go, the immune system goes and kills the cancer cell. This thing, so there is two drugs. One is called pembrolizumab, also known as Keytruda, and this is the sister drug this is made by a company called Merck, this is made by a company called BMS. They are the giants in drug industry. So this pembrolizumab got approval for around 26 different indications in cancer. It's the standard of care now for treating melanoma. I treat melanoma also at Huntsman, and my whole clinic gets this thing. Very good response. We are actually putting 40 to 50% of the people into remission just with this drug, very safely tolerated. It got approved for lung cancer, it's approved for lymphoma, it's approved for liver cancer, it's approved for kidney cancer, it's approved for certain types of colon cancers which have a specific mutation which we call as mismatch repair. It's approved for head and neck